Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How do I use the Tresiba FlexTouch pen? Ask your doctor or nurse to show you how to administer your Tresiba FlexTouch pen before you attempt to self-administer it. A new needle should be used every time you inject yourself. You can inject yourself into your abdomen, thigh, or upper arm. Use the dose counter to select the correct dose prescribed for you and then hold the pen at a 90 angle to your skin. Press the green injection button. Leave the needle in your skin until after you have counted slowly to 6 once the dose counter reads 0. Remove the pen, take off the needle and throw it in a sharps container, then recap the pen. Tresiba is an ultra-long-acting human insulin analog, insulin degludec, that is given by subcutaneous injection, under the skin, for the treatment of diabetes in adults and children over the age of 1 year. There are 2 types of Tresiba FlexTouch pen. Tresiba FlexTouch U contains 300 units of insulin. Units can be increased by 1 unit at a time. Maximum dosage each use is 80 units. Tresiba FlexTouch U contains 600 units of insulin. Units can be increased by 2 units at a time. Maximum dosage each use is 160 units. Tresiba is also available in a 10 ml vial. The vial contains 1000 units of Tresiba. Tresiba should be kept refrigerated at between 36°F to 46°F, 2°C to 8°C, until it needs to be administered. Once in use, Tresiba should be refrigerated or kept at room temperature, below 86°F, 30°C, away from heat or light. Tresiba may be kept out of the fridge for up to 8 weeks, 56 days. How do I give myself a Tresiba injection? Wash your hands with soap and water. Check the label on the FlexTouch pen to make sure you are taking the right type of insulin. Pull the pen cap straight off. Look at the fluid in the viewing window. Tresiba should be clear and colorless. Do not use Tresiba if it is cloudy or colored. Do not use Tresbia past the expiry date or 56 days after you first start using the pen. Always use a new needle for each injection. Do not reuse or share needles. This helps ensure sterility and reduce the risk of infection. Attach the needle to the pen by removing the paper tab and pushing the needle straight onto the pen. Twist the needle on. Take off the needle cap and keep. Pull off the inner needle cap and throw away. If using the pen for the first time you need to prime it. Turn the dose selector to 2 units. Hold the pen with the needle pointing up. Tap the top of the pen gently a few times to let any air bubbles rise to the top. Press and hold in the green dose button until the dose counter says 0. A drop of insulin should be seen at the needle tip. If a drop does not appear, repeat the priming procedure. Select your dose of insulin. The pen is designed to deliver exactly the dose of insulin your doctor has prescribed. Before selecting your dose, ensure the dose selector is aligned with 0. If it is not, press the green dose button until it is aligned with 0. Turn the dose selector to the number of units you need to inject. For example, 5 units. The dose pointer should line up with your dose. If you select the wrong dose, you can turn the dose selector forwards or backward to the right dose. The even numbers are printed on the dial, the odd numbers are shown as lines on the U pen. Choose an injection site on your thighs, abdomen, but not within 10 cm of your belly button, or upper arm, and wipe it with an alcohol wipe. Let it dry. Do not use a site where the skin is discolored, bruised, broken, covered with a psoriatic lesion, or has a rash. Rotate your injection site each injection. Ask your healthcare provider if you need to pinch up the skin or not. Insert the needle of the Tresiba pen into your skin at your chosen injection site at a 90 angle, straight up and down. Press down the green dose button. Make sure your fingers are not covering the dose counter, as this may stop the injection. Press and hold down the dose button until the dose counter shows 0. Keep the needle in your skin after the dose counter has returned to 0 and slowly count to 6. If you remove the needle before this time, you may see a stream of insulin coming from the needle. If you do happen to see a stream of insulin coming from the tip of the needle, it means you have not received a full dose of insulin and you should check your blood sugar levels more often because you may need more insulin. Pull the needle out of the skin. If there is blood, use a piece of gauze to press lightly down on the area. Do not rub. Carefully remove the needle from the pen and throw the needle away in a sharps container. Do not recap it. Do not store the pen with the needle attached. Replace the pen cap by pushing it straight on. Once your pen has run out of insulin, throw it away in an approved sharps container and dispose of the sharps container when full according to state or local laws. Related questions: what is the difference between Soliqua and Xultophy Toujeo versus Tresiba? What's the difference between them? Is Tresiba the same as Lantus? RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.